Welcome to the fourth video dedicated to CONSORT, the reporting guideline for interventional studies. We want to explain the main risks of bias, or how to screw it up completely. Let's begin. Let's review the threats that a researcher faces. A good clinician will want to give his best intervention to the most serious cases, selecting differently the patients in both groups. This way, the groups would lose their comparability, selection bias. If a researcher does not believe that both interventions are ethically assignable to these patients, they should give up the study. Randomization and concealing the intervention until the end of recruitment prevent it. That clinician who is not convinced of the ethics of the study could also treat differently patients in both groups. For instance, give additional or rescue interventions to patients in the control group. We prevent it by masking the treatment, maybe with a placebo. We have already defended the importance of a complete follow-up. Of course, the patient or the clinician may decide to interrupt the intervention, but that does not mean excluding it from follow-up, since it is important to analyze in how many cases it happened and how they have evolved. We should also prevent from being more generous when assessing the response in one of the groups, by masking or by the use of measurement processes, independent of the researcher. Finally, it is advisable not to fall into the temptation of reporting that statistical result that suits us best. We guarantee this by publishing the statistical analysis plan before having access to the data. Undoubtedly, the easiest quality criterion of a study is its level of follow-up. The REVASCAT study obtained the 3 months evolution of the 206 randomized patients with stroke, merit of the researchers who followed and pursued each patient, of the monitors who promoted the quality of data, and of the designers who defined a main response that incorporates death among its possible values. If both patients and researchers faithfully adhered to the medical advice in the protocol, it would not be necessary to distinguish between efficiency and effectiveness, nor define subsets of data trying to save face. Remember that, at the theoretical level, only the comparison of the groups, just as they were assigned, is protected by randomization. On a practical level, certain deviations from the protocol may discourage that intervention in that environment. Let's say, to conclude, that double-blind is ambiguous. You should specify who is blinded: the patient, the people who recruit them, or those that treat them, or follows them, or evaluates them. And that's all for today. Well, no. One final advice. Practice. Check if your article includes blinded investigators, or better, specifies which researcher is masked. See you in the next video.